As a child, most of us receive the required vaccinations. But did you know that as we age, the Centers for Disease Control recommends over 7 different vaccinations? Here today to talk about the top recommended vaccines for seniors is Dr. Donald Herip with Baptist Occupational Health. Good morning, Dr. Herip. Thank you so much for joining us.
Oh, thanks. I appreciate the invitation.
Well, and I'm really glad I said your name right, because earlier you tried to trick me with another word, but I said it right, so I'm proud.
You did very good.
Thank you. Well, tell us a little bit about yourself and how you became a physician.
Well, I've been a practicing physician for about 30 years. I started my medical training at Wright State University in Dayton, Ohio. After medical school, doctors are required to perform residency training programs. And I did 3 of those. One of them was the family medicine residency training program here in Pensacola at the Naval Hospital. And I did 2 other training programs at Johns Hopkins, a little school in Baltimore, Maryland.
We've heard of that.
So I did occupational medicine training there as well as preventive medicine. The first about 20 or so years of my physician career has been the U.S. Navy.
Wow.
Practiced all over the nation, East Coast, West Coast, Gulf Coast, Europe, Central America, Asia. I had the opportunity to live in Asia for over 6 years.
I'm going to try really hard not to be jealous that you've traveled to all those places.
Sometimes you shouldn't be jealous. It's pretty tough when you're living in developing countries.
Sure.
Yes. So 20 years in the Navy. I retired in 2004 and set up a civilian practice in San Diego, California as the medical director of a corporate health program. And just recently, in September of 2014, I was able to assume my new position here at Baptist Medical Group as the medical director of the Occupational Health and Urgent Care Clinic at the Baptist Medical Park located on 9 Mile Road.
Perfect, and I'm sure they're really excited to have you.
Well, they say so.
They wouldn't lie to you. I'm sure that I know people there. They wouldn't lie.
Okay.
So tell us, what is occupational health? Because when I think of occupation, of course, I'm thinking career. I'm not thinking, how is it health related? So tell us a little bit about that.
Yeah, that's actually a very good question, because many people don't really understand what occupational health is. There's other subspecialties in medicine like pediatrics, internal medicine, dermatology. People sort of understand what those doctors do. Occupational health doctors, we specialize in workplace injuries and illness. People may not realize it, but we have 150 workers in the United States that go to work every single day. And they may be exposed to chemical hazards, physical hazards, radiation hazards, ergonomic hazards with lifting equipment, et cetera. So we're trained to recognize, evaluate, and treat those type of diseases. So it's treatment of workplace injuries and illness and prevention of those injuries and illness. The other thing we do, and which is good for the employers and the corporations, is we keep them out of trouble. So how do we do that?
Sure.
So we perform the mandated medical surveillance exams by OSHA. OSHA is the Occupational Safety and Health Administration. They mandate that if a worker is exposed to a certain chemical or airborne contaminant or hazardous noise, et cetera, they need to have routine medical surveillance exams. And the purpose of those exams is to detect early adverse health effects that may be taking place from their exposures at work. So we do that to keep the employers out of trouble.
Perfect. Well, I'm sure most employers would say that they appreciate that.
Well, they like being kept out of trouble, yes.
Sure. Well, let's talk about what your topic is today, and that's vaccinations, and vaccinations particularly for seniors. That's our audience. So what are some recommended vaccines for older adults?
Well, I have a handful of vaccines that I think all older adults should consider. Number 1, unfortunately, this vaccine you need to get every single year.
Is that the flu shot?
No, it's not the flu shot. It's the influenza vaccine.
Gotcha.
So we don't use the word shot in medicine.
Okay, good to know.
We have flu vaccine. So the influenza vaccine, and the problem is this virus seems to change every year. So from a medical perspective, we have to do worldwide surveillance early in the year, January, February, March, to see what the circulating strains are. And then after that, manufacture a vaccine that will cover the current circulating strains. That vaccine is tested. Number 1, does it work? Number 2, is it safe? And number 3, can we make enough of it so it's ready by September, October to start giving to the general population to prevent the flu? So they need to get it every single year. One thing that most people don't realize is that, well, first of all, most people think you get the flu, you get a headache, high fever, muscle aches, 3 to 5 days, you miss work, you go back to work. But what happens in the elderly population? They may have pre-existing lung disease, heart disease, etc., they may get the flu, and they may develop
Affects them differently. Right.
serious complications, they actually die. Some years we get up to 50,000 excess deaths just from influenza complications. And guess which age group accounts for more than 90% of the deaths?
Seniors.
Seniors.
I love it when I pass the quiz, when you ask me a question.
You got an A+ today. So 90% of influenza-related deaths occur in people over the age of 65.
That's really good to know.
So that's why they need to get the vaccine.
Sure. And you've kind of answered this question, but why are these vaccines recommended? Just to make it crystal clear, because I think people are hesitant to jump to get a vaccination. It's kind of uncomfortable. You don't really know what the side effects are going to be.
We know all vaccines will have minor side effects.
Sure.
Remember, from a general perspective, vaccine is a foreign protein. We inject it into your arm, and the body says, oh my God, that's a foreign protein. I'm going to start developing antibody to that, which is good, because you develop enough antibody to that foreign protein to become protected. Well, you know, during that process where you're developing an antibody, you may have some localized tenderness, redness, pain, swelling, etc. And that's just a robust reaction to the vaccine, which is actually a good response. Your body's recognizing that as a foreign protein and developing a response. But to get back to your question, why get the vaccine? Well, number one, you prevent illness in yourself. And number two, and just as important, if you protect yourself, you will also protect your family members, your coworkers, and the community.
Sure.
People don't realize, I'm turning down this vaccine, I don't want it. Well, you're also putting your family at risk, your coworkers, et cetera.
Yep, absolutely. And I think that is a great point. So you mentioned the flu vaccination. So what are some of the other vaccinations you'd recommend?
Okay, so for the more mature audience.
Uh-oh, I don't know how mature I am.
For me, it's 10 years older than I am.
Okay.
So we cover influenza every year. The other one is the quote-unquote pneumonia vaccine, and that's a short term for the pneumococcal vaccine. That stands for a type of bacteria that causes a severe blood infection, a severe brain infection we call meningitis, and a severe lung infection that results in pneumonia. And the death rate from a pneumococcal pneumonia is very, very high, and in the elderly, it's even higher. So healthy adults older than the age of 65 should go see their primary care doctor, and they would be eligible for the pneumococcal vaccine or pneumonia vaccine. Even though you're not 65, if you're younger and you have other pre-existing medical problems, heart disease, lung disease, sickle cell disease, previous cancer, HIV infection, immunosuppression, et cetera, you would also qualify for that pneumococcal vaccine. So it's highly recommended in that age group, since a pneumococcal infection will not just make them sick, it can also kill them.
Right.
So we covered the influenza vaccine and the pneumococcal vaccine.
Great. And this is a lot of great information, and if we had 20 more minutes, I'm sure that we could really go in depth in it. And
I need more than 20 minutes.
I know, me too. It's great information. I've actually learned a lot myself. I'm really bad about getting the flu vaccine. I want to say shot so badly.
I get it every year, just so people know I practice what I preach.
So I definitely, this has encouraged me for sure to go out and get that.
Good.
But I know folks are still going to want more information. So where can they find information about vaccinations before we wrap up?
I think the best place to find information about immunizations, vaccines, et cetera, is number one is their primary care doctor. And the reason I say that is the primary care doctor knows their medical illness, previous surgeries, what medicines they're taking, what allergies they may have, allergies to medications, allergies to egg proteins that may be in some of the vaccines, allergies to latex. That's the best place to go, asking the primary care doctor. Otherwise, you can go to our Baptist Healthcare website. You can visit our clinics.
Great.
We're happy to give more information regarding that. And there's other vaccines that the seniors need to consider too.
Sure. And all this information they could probably find on the website and some other resources.
Correct.
Perfect. Thank you so much for joining us again. We really appreciate it.
Oh, thanks so much for the invitation. Appreciate it.
Thank you.